Hello, welcome to Path 300, Entry with Contacts and Services. I am your trainer, HMIS Program Specialist, Shantae Smith. During this training, we'll be working in the system to enter a client that is being outreached using the Path workflow, as well as how to learn to enter services provided to our client. Please note that if you have any questions, you can contact us at the HMIS Help Desk via email at hmissupport@cir.org or by phone or text at 602-908-3605. Before we begin to work through the process of entering a client into the system, let's discuss a few important things that will help you with the Path workflow within the HMIS system. These points will not only help in guiding you through your Path workflow, but they are also extremely important things to remember because this can affect reporting for Path projects. First, ask yourself, where did the first contact take place? During actual street outreach or in a service setting such as a shelter or drop-in center? Contacts that take place during the street outreach must be recorded in a separate Path project from those contacts that take place in a service setting. Next, determine which Path project to use for the potential client's entry based on the answer to the question above. Path Outreach, which is street outreach, or Path Inreach, a service setting. An entry should be created in HMIS at first contact with the potential client, along with a contact date on the client record. All potential Path clients must have a disability type of mental health problem documented on the record immediately, even if it is not yet confirmed. A service and/or a referral is documented at each contact or interaction. Each contact date thereafter should be recorded on the client record via interims. All services and referrals should continue to be documented as they happen. Once the client is engaged or ready to be enrolled in Path, an engagement date is entered on the client record. Engagement date is recorded on the client record via interims. All services and referrals should continue to be documented as they happen. If the client becomes engaged at first interaction, record first one contact date and then an engagement date on the same day on the client record. After the engagement date, all Path client record data quality standards apply in HMIS. The enrollment and Path date should be documented on the client record on or after the engagement date via interims. If the client is found ineligible for enrollment, document in the client record and exit them from the Path project. Lastly, clients should be exited from the Path project for a few reasons. 1, they are found ineligible or decline services. 2, they become housed. Or 3, they lose contact with the Path case manager for more than 6 months. Now that we've covered those important things, let's get started. Once you log into the system, go to the top right-hand side of the screen and get into the proper Enter Data As mode. This is where you will decipher whether your client is an in-reach or outreach. As a reminder, this is based off of where you first met your client. Then you will get into backdate mode if applicable. For this example, we will enter into backdate mode as of August 1st of 2015 to show a progression of our client. Next, you will go to the menu bar and click on the Client Point button. If you remember from HMIS 100, the Client Point button is the module you will use to begin your client search within the system. As a Path outreach worker, it is very common for your client to provide you with a nickname or a code name when you're meeting them for the first time. It is okay to list the name that they provide for now. We say this because you're able to change their information at a later time. So for this example, we'll say I went to the Care Bear Park to outreach with potential clients. I came across a gentleman, and after a few moments of conversation, I determined that he may possibly be SMI. I began to gather some information on him to build a rapport. He tells me his name is Tom, but refused to provide me with the last name. So for data entry purposes, I will list his first name as Tom, and I will list his last name as Care Bear Park. And then I will list his name data quality as a partial street name or code name reported. You do have the option of a full name reported, client doesn't know, client refused, and data not collected. I list his name as Care Bear Park and say that it's a partially street name or code name reported, so I can easily identify him within the system and keep track in the back of my mind that I will update the information as soon as he provides me with his full name. As required by my project, I will fill in as much information on the client search screen as possible to facilitate not only good results and matches, but new client record creation. Tom doesn't feel comfortable giving me his social security number, so I leave it blank. Then I use the designation of client refused. You will see this option available throughout the client record. As stated before, same as client doesn't know and data not collected. Client doesn't know literally means the client doesn't know. Client refused means that the client refused to provide you with the information. And data not collected means that you, as the interviewer, did not ask the question. These options are available for use, but please use them sparingly. But Tom tells me that he is a U.S. veteran. Once I have this information correctly completed, I will click Search. Once I click Search, down at the bottom of the screen, the system tells me that there are no client matches. This means that this particular client and name does not currently exist. So my next step is to add them into the system. I do this by clicking Add New Client with this information. Once I do, a warning box will appear. This is basically asking if you're sure you want to add a new client, and by clicking OK, you are consenting to it. As a side note, if you perform a client search and see a client name and information that closely resembles the one you just entered, and you're sure it's the same person, please use that existing client record and do not create a new one. But if you notice that there are some differences, go ahead and create a new client record, and then once we are able to determine that it is in fact the same person, the HMIS team can merge the client profiles into one. So once you've clicked OK, you'll be directed to what is called your client record. On the top left side, you will see a set of numbers inside parentheses. This is your client's HMIS ID number. You can use this number to identify them within the system or by their name. Below that, you will see tabs, and each tab has a different function. The first tab you will see is the client profile. On the client profile, the first box you will see is the client record. This is where your client's name, social security number, and veteran status can be edited using the Edit pencil to the left of where it says Client Record. Below the client record, you will see a box titled Client Demographics. This is the area where you will see your client's basic demographics populated after you've completed the information on the entry assessment via the EntryExit tab. Please do not edit, add, or delete any information from this box. The information will always be populated from the entry assessment via the EntryExit tab. Next, you will see Arizona Client Notes. This is the section where you'll enter in all client, progress, or case notes on your client. Underneath is Client Notes. This is not used, so please do not enter any information here. Next, you will see an area of file attachments. This is where you can upload scanned documents, such as birth certificates and ROIs. Lastly, you will see incidents. This is an optional way of communicating about client disagreements with guidelines or max day allotted within the project. If you scroll back up to the top of the screen, you will see the next tab called Households. This is used for family groupings to connect household members together with a household ID. EntryExit is where all client entry and exits are recorded into your project, as well as contact dates, date of engagement, and assessment data. We will come back to this tab when we're ready to begin to enter our client Tom into our project. Then you will see the Case Managers tab. This is where specific case managers can be assigned to a client electronically. Before entering your client into the project, you must add yourself as a case manager for this client. To do so, you will click on the button that says Add Case Manager. And once you do, a box will appear and you will find a blue radio button that says Me. Click it. Then, all of your information will automatically populate into the appropriate fields. Then you can click Add Case Manager. It will take you back to the Case Manager screen and you will see your name listed as the Case Manager. Once you are no longer working with this client, you will click on the Edit pencil to the left. The box will appear with all of your information and you will list an end date as of the last day you started serving this client, and click Save Case Manager. Next, you will see Case Plans. This is where goals can be set and case notes can be added if your agency uses this option to the client record. Goals can be printed and signed before adding to the client's paper file. Service transactions. This is where all referrals and services can be recorded, and the history of such viewed. Service and referral tracking in HMIS are required of PATH teams. We will talk more about services later in this training, and referrals are discussed in the PATH 302 session. Now that we are familiar with the functions within a client profile, let's continue working with our example client Tom and move through the PATH workflow requirements of entering him into our project. From here, go ahead and click on the button that says Client Information and then Client Profile so you get back to the main page. Let's do a brief recap. On August 1st of this year, we went out to the Care Bear Park and came across a gentleman we later found out whose name was Tom. Tom wasn't comfortable enough providing us with his last name or his social, but he told us that he was a U.S. military veteran and a story about his past. During the conversation, I assumed that Tom is SMI, but found out it isn't documented yet. So I have committed to helping Tom get his disability documented and to getting him connected with proper services. I have already created his client record, and now it's time to enter him into my project as of August 1st of 2015, because that is the first day I met him. To begin, from your client profile, locate the EntryExit tab. Once you click it, you will locate the button that says Add EntryExit. This is where the EntryExit Data box will appear. You will ensure that the correct provider is listed. This should match what you have EDA'd into. Then you will select the type. Your type will always be PATH. This does not matter whether you're an inreach or outreach. And then keep in mind that all assessments for the PATH projects are held under the PATH entry type. Then you will ensure that the correct date is listed. This should be the date that you have backdated to. If these dates do not match, we need to get out of this screen. Now you can click Save and Continue. This is where you'll be redirected to the EntryExit Data screen where you will begin to complete the assessments. At the top, this is another space where you're able to check to make sure your correct provider is listed, as well as the entry type as PATH. Below that, you will see the default assessment, PATH Entry Assessment. Please keep in mind this assessment has two parts to it. The top part is labeled Universal Data Elements, and the second, or the bottom part, is labeled PATH Program Data Elements. You are required to complete the contact information at each interaction via the outreach sub-assessment. Until you have engaged your client, you're only required to record the universal data elements. Complete as much as you can at every interaction. To complete the contact information, follow the steps as directed. This is where you're going to locate the outreach sub-assessment, which is at the top of the path entry assessment, and locate the button that says Add and click it. A new outreach record set will appear for you to complete. Start with the date of contact. In this case, it's August 1st of 2015. That is because this is the first time we ever met our client, Tom. As a shortcut, you can click on the calendar with the green check mark to auto-populate the day for you. This shortcut will auto-populate to the date you've set your backdate to, or if you're not in backdate mode, it will set it to the present date and time. Next, you will use the drop-down box to select the location. This refers to where you actually met with this client. There are 3 options: place not meant for habitation, service setting non-residential, or service setting residential. For outreach purposes, this is typically the place not meant for habitation, meaning out in the street, a park, abandoned building, etc. The service setting options are typically used when in-reaching. Once you've listed your location, you will just click Save. But if you notice that the start date does say it should be the same date as the date of contact, which this is already populated for you. Now, after clicking Save, it will take you back to the path entry assessment. From here, you should fill out as much information as you can that your client reports to you within the first interaction, the universal data elements. As time goes on and you build that relationship, your client will gradually provide you with all the necessary information. So let's begin with the date of birth. Using their date of birth and 4-digit year, if the client cannot give you a date of birth, ask their age and approximate their date of birth by using the 0101 for the month and day. In our case, Tom will not give us his full date of birth, but he tells us he's 30 years old. We know if you're 30, you were born in 1985, so we will use this generic date of 01/01/1985. Then I must record the date of birth type. Full date of birth reported, approximate, partial, or date of birth reported, or data not collected. Again, since he told us that he was 30 but didn't give us his full date of birth, we're going to say that it's approximately reported. Then, you will list your client's primary race and ethnicity. If you aren't sure how to define it, take your cursor and hover over it, and it will provide you with the HUD definitions. Keep in mind, if your client reports to you to be of Hispanic or Latino descent, their primary race is white. Their ethnicity is Hispanic Latino. Also, if your client reports to be Middle Eastern or European descent, their primary race is also white, then their ethnicity would be Hispanic or Latino, depending on if they had Spanish origins. Also, there is a spot for a secondary race. If your client does not report to have a secondary race, please skip this option. Tom tells us that he is half black and he is half white, but he does not have any Hispanic origins. Next, you will list your client's gender. If they report something other than what is on this list, then you're going to use this option of Other and use this text field box below to specify what the other gender is. But from this list, you have the option of female, male, transgender, male to female, transgender, female to male, other, and data not collected. In our case, Tom does report to be a male. Does your client have a disabling condition? You will select yes or no. If you hover over this question, you'll be provided with detailed information about HUD's disabilities and their definition. But if you remember, in our summary, at first interaction, your clients must have a disability documented. So this question must be answered yes. For the first time you're meeting your client, he doesn't provide you with much information, and that's okay, as stated before. So as you continue to work with this client, the other pieces of data will be eventually collected. But before we exit out of this assessment, we must answer a few other questions. You'll notice that the relationship to head of household question is bold with an asterisk. This means that it is required to be answered prior to exiting this assessment. And in this case, since you serve singles, it will always be self, head of household. Then you must scroll down past the path program data elements and locate the question that says covered by health insurance. This too, you will notice, is bold with an asterisk, meaning it is required to be answered. This is where you should answer the question yes, no, client doesn't know, client refused, or data not collected. Since in our case we didn't ask the question, we're going to answer this as data not collected. Keep in mind that as time goes on, we will have to update this after engaging our client. And remember, as stated in the beginning, you must record the disability of mental health for your client at first contact. So since we answered the question of if our client has a disabling condition, in this disability sub-assessment, this is where we must list the disability. To do this, you will click on the HUD Verification hyperlink located to the right of the sub-assessment. Once you do, a record set box will appear where you need to list your client's reported disability. After speaking with Tom, he says that he does not have any disabilities other than his mental health. So you can click the blue radio button at the very top that says no. By doing this, it answers all of the questions no for you. Then, from there, you can locate the mental health problem and click yes. Once you do, this new record set will appear. At the very top, you will notice that it says that the disability type is mental health problem, and the disability determination says yes, because yes, as of right now, it is self-reported. Then you have these questions to answer. If yes, is it expected to be of long continued and indefinite duration and substantially impair ability to live independently? This question will be answered yes, because Tom's mental health problem impairs him to be able to live independently. Then you have the question, if yes, documentation of the disability and severity on file. At this point, we do not have documentation because it has not been confirmed. Then you have these next two questions. These are path-specific questions, but please keep in mind, these questions only need to be answered for the mental health problem, alcohol abuse, or drug abuse disabilities. It does not have to be answered on any other disability reported. So this question is, if yes for mental health problem, alcohol abuse, drug abuse, or both alcohol and drug abuse, how is it confirmed? You have the options of unconfirmed, presumptive, or self-report, confirmed through assessment and clinical evaluation, or confirmed by prior evaluation or clinical records. In this case, we're going to say that it's unconfirmed because it's a self-report. Then, if yes for mental health problem, serious mental illness, and if SMI, how was it confirmed? You have no, unconfirmed presumptive self-report, confirmed through assessment and clinical evaluation, confirmed by prior evaluation or clinical records, client doesn't know, and client refused. In this case, it is unconfirmed because it's a presumptive self-report. Then, if yes, are they currently receiving services or treatment? Well, as of right now, Tom is not. Is the above condition going to be long-term? Yes, it is. The start date. This does not have to be the date that they were diagnosed with this disability. It can be left as the date that it was reported to you. Then you can click Save. Since Tom confirmed that he does not have any other disabilities, we will go ahead and click Save and Exit. It returns us back to the screen, and we will notice now that we have a green check mark at our HUD verification. This means that it has been completed. From here, you will scroll to the very bottom of the assessment and click Save and Exit. Then you will be redirected back to the EntryExit Preview pane. This is where you will see your project name, date of entry, and the appropriate client count, meaning how many clients were associated to this entry. Next, you will need to enter in a service of street outreach. Before we started this example, I stated you must record every contact date you make with your client, as well as at least one service transaction of street outreach. To do that, follow these steps. From the EntryExit tab, go to the tab that says Service Transactions and click it. You will then be taken to your service transaction dashboard. This is where I will need you to locate the button that says Add Service and click it. Once you do, your screen will change and you will need to complete the information listed. First, check to make sure that the correct service provider is listed. Remember, this should match your EDA mode. Next, you will ensure that the start date and end date is listed. These dates will auto-populate for you as the same day, and it's either the day that you have backdated to, or it is present day. Next, you will choose your service type. Remember, this must be street outreach. You have this long list to choose from. Please keep in mind there's no need to deviate from this list because this list has been specially created for PATH projects. So again, we're going to select our service type of street outreach programs. Then we're going to use this provider-specific service. And at this point, you have 3 options, and it's going to be street outreach. Then click Save and Continue. The next screen, you will continue to edit the service that is just provided. But again, I need you to double check to make sure that your service provider and your start date and end date and your service type is correctly listed. Please do not enter service notes in this box. All service notes should be entered in the Arizona Client Notes sub-assessment that is located on the client profile. There is a PATH-specific question that must be answered. If it is not, this information will affect PATH reporting, so please be sure to complete it. The question is, type of PATH-funded service provided. You will use the drop-down list to select one of the options: outreach, screening or assessment, habitation rehabilitation, community mental health, substance abuse treatment, case management, residential support service, housing minor renovation, housing moving assistance, housing technical assistance, security deposits, one time for eviction prevention, or other PATH-funded services. In this case, we are going to select outreach. Next, I want you to skip over the service cost section since your project does not complete that, as well as the apply funds for service and the supporting documentation. If you wanted to follow up with your client in regards to this service, you can do so by using this section. Lastly, you will need to complete the need information. For all services provided, your need status will always be closed, and the outcome of your need will always be fully met. This is now where you can click Save and Exit. You will then be returned to the service transactions to see that you now have one service completed for this date of street outreach programs. Now that we've completed our first entry, let's go back to the home screen to talk about and work through our next scenario. Now, we've completed our entry into our project for our new client, Tom. Upon our first contact, Tom didn't provide us with much to work with. Even then, we entered him into the system, listed our initial date of contact, completed some of the UDEs, Universal Data Elements, and listed our service transaction that was street outreach. Now, let's say a few weeks have passed and we have gone back out to the park to find Tom. Once I do, I talk with him a little more and gather more information about him. Once I get back to my agency, I will log into the system so I can enter in the new information I've gathered on my client. To begin, I will be sure that I'm in my EDA mode for the Path Outreach project, and then I will backdate to the actual date that this new interaction took place, which is August 21st of 2015. Then I will click Set Backdate, and I will locate the Client Point module. This is where I will search for my client. I remembered that his name in the system is Tom Care Bear Park. And that he was a U.S. military veteran. Once I enter that information, I will click Search. Once I do, I notice that my client appears down in the Client's Results section. From there, I will click on his name and it'll take me straight to my client's record. From the defaulted Client Profile tab, I will go to the EntryExit tab. This is because I want to list a new date of contact for my client as well as enter in the other information he provided me with. I will locate his existing entry and click on the Interim's notepad, located on the right, to complete what is called an interim review. A few tips to remember. Once you've created an entry into your project for your client, you do not have to create a new one to list the new information. You would just complete an interim. Also, to make updates to your client record, you will never go through the entry to do so. All updates will be completed within the interims. So after clicking on the notepad, a new box will appear. And then this was where I will click the button that says Add Interim Review. The interim review record set will appear and your provider and entry type will already be listed. You will need to complete your interim review type, and in this case, it will be Update. Then make sure your review date is listed correctly. Remember, this should be the day you've backdated to, which is August 21st of 2015. Then you will click Save and Continue. You will then be taken to the interim review screen to complete your assessment. If you notice in the Select Assessment Preview pane, the Path Update Assessment is highlighted to show that it is auto-defaulted. We need the Maricopa UDE assessment so we can complete the UDEs. So from here, we're going to complete the rest of the assessment questions, starting with the residence prior to project entry. Residence prior to project entry means where did your client sleep the night before they came to your project? Keep in mind that place not meant for habitation can be used if your client slept on the streets, a car, a park, or abandoned building. But to see this list, if you use the drop-down list, you'll see that there's the emergency shelter, including hotel or motel paid with emergency shelter voucher, foster care home or foster care group home, hospital or other residential non-psychiatric medical facility, hotel or motel paid without emergency shelter voucher, jail, prison, or juvenile detention facility, long-term care facility or nursing home, owned by client with no ongoing housing subsidy, owned by client with ongoing housing subsidy, permanent housing for formerly homeless persons, place not meant for habitation, which again can be used if your client slept on the streets, a car, a park, or abandoned building, psychiatric hospital or other psychiatric facility, rental by client with no ongoing housing subsidy, rental by client with VASH subsidy. VASH is Veterans Affairs Supportive Housing. Rental by client with GPD tip subsidy stands for Grant Per Diem Transition in Place. Know that these two are typically veteran projects. Then you have rental by client with other ongoing housing subsidy. That's if your client was staying in a Section 8 home or in a rapid rehousing project. Residential project or halfway house with no homeless criteria. Safe haven, which is transitional housing for those individuals who are SMI. Staying or living in a family member's room, apartment, or house. Staying or living in a friend's room, apartment, or house. Substance abuse treatment facility or detox center. Transitional housing for homeless persons, including homeless youth. Other, client doesn't know, client refused, and data not collected. Please remember, if you use this option of other, please use the text field box below to specify what other actually means. But in this case, our client did report to have come from the streets, so we're going to document this as place not meant for habitation. Then you have length of stay in previous place. This question relates to the residence prior to project entry. And for this question, we would like to know how long your client resided there. Tom tells us that he was sleeping on the streets for the past 4 years. So then I have the option of 1 day or less, 2 days to 1 week, more than 1 week but less than a month, 1 to 3 months, more than 3 months but less than 1 year, 1 year or longer, client doesn't know, client refused, and data not collected. The zip code of last permanent address. Please specify the 5-digit zip code of the last place your client was housed for 90 days or more. If your client cannot remember the exact zip code, then please use the last city they resided in to complete this question. There is a cheat sheet, and if you take your cursor and hover over this question, you'll be provided with city and county and zip code information. Tom explained that he could not remember his last zip code because it's been too long. But he did remember he was in Glendale. We've already answered the relationship to head of household, so we can skip it. Client location is the continuum of care code, also known as the COC code. This was assigned to the Maricopa County projects as AZ502. There's only one option in the drop-down menu, so please make sure to choose it. Homelessness primary reason. Choose the reason of why your client has become homeless. Tom explains that he is homeless because of his mental illness. It's gotten in the way of things. So from this list, you will see aged out of foster care, client doesn't know, client not homeless, client refused, criminal activity, data not collected, domestic violence, economic, evicted, family dispute or overcrowding, loss of job, medical condition, mental health, move to seek work, natural disaster or fire, release from jail or prison, relocated, substance abuse, and trafficking exploitation. Please keep in mind that there is a difference between domestic violence and trafficking and exploitation. And if you are unaware of the legal definition of trafficking and exploitation, please take your cruiser and hover over the question, and we have provided it for you. But again, Tom tells us that his mental illness has gotten in the way of things. So his homelessness primary reason is mental health. The length of time on street, an emergency shelter, or safe haven. The following questions can assist in determining if the client meets the HUD definition of chronic homelessness. A handout with detailed instructions on how to answer the length of time on street is attached to your training confirmation email. This first question, client entering the streets, from the streets, emergency shelter, or safe haven. Only answer yes to this first question when the client is entering your project directly from the streets, emergency shelter, or safe haven. The exception is if they were in an institutional setting for less than 90 days and came from one of those locations just before being institutionalized. Tom tells us he has been on the streets continuously for the past 4 years. Next, you will enter this question, since we have answered yes, to the client entering from the streets, emergency shelter, or safe haven, the approximate date that it started. Keep in mind that if you answered this question no, you would then skip this question. But since Tom is coming directly from the streets, he tells us that he's been on the streets for the past 4 years. Keep in mind when entering the date the client's current episode of homelessness started, you may use their current entry day into your project if they can't remember the exact day. For example, Tom doesn't remember the exact date he became homeless, but he knows that it was 4 years ago. So I can type in 08/01 of 2011. Then, count the number of times the client has been homeless in the past 3 years, even if they are not entering your project directly from the streets, emergency shelter, or safe haven. That is for this question. Regardless of where they stayed last night, the number of times the client has been in the streets, an emergency shelter, or safe haven in the past 3 years, including today. Only use the option of never in the past 3 years for diversion or homeless prevention because the question says to include today as an episode. Tom explained that he's been on the streets all 4 years and have never entered a safe haven or emergency shelter. He's also never been served by another agency. Then, the total number of months homeless on the street, emergency shelter in the past 3 years is where you're going to give us the total number of months. Since Tom has explained that he's been on the streets for all 4 years and never entered into another project, it would be more than 12 months. Next, you have this question of length of time homeless, status documented. There are 2 forms of documentation you can accept. One, if you can log into the system and see that your client has visibly been served by another tab by looking at their EntryExit tab, that can count as verification. Or 2, in the event that your client signs a self-statement or a client affidavit, you can also accept that as a form of verification. Since Tom has neither, we are going to say no. Now you've completed your universal data elements, but don't remember your outreach contact date. Since today is the 21st, we have to document that we met Tom today. To do so, click the button that says Add. List your date of contact by clicking that calendar with the green check mark. And the location, which we met him out in the park again. Then you can click Save. From here, you can scroll to the bottom of your screen and click Save and Exit since you are unable to gather any other information. Once you do, it takes you back to the screen where you've completed your interim reviews. If you click this Exit button, it'll take you back to your EntryExit Data screen. You will now notice a number 1 listed on the Interim's notepad to notify you that you have 1 interim update completed on this client. But don't forget your service transaction. So next you will need to enter in at least 1 service of street outreach. In this case, we provided Tom with the service of street outreach and material goods. So now we will walk through how to enter multiple services for this 1 client. From here, go to the tab that says Service Transactions and click it. You will then be taken to your service transaction dashboard, and I want you to locate the button that says Add Multiple Services. Once you do, your screen will change and you will need to complete the information listed. First, you'll make sure that the correct provider and dates are listed. Then you will enter in the number of services, and in this case, it is 1. Next, you will choose your service type. Remember, this must be the service of street outreach. Then your provider-specific service of street outreach. And then don't forget your type of path-funded service provided as outreach. Then you will locate your need information. Remember, your need status should always be closed, and your outcome should be fully met. From here, I want you to click the button that says Add Another. Once you do, you'll notice that a new section will appear where you can add another service. This is where you will enter the number of services of 1, and then your service type now will be material goods. This is because we provided Tom with the sack lunch and some water. Then you will choose the provider-specific service of outreach. And the type of path-funded service provided, again, will be outreach. You will skip over your service costs and the apply funds for your service and complete your need status as closed. And the outcome of your need will be fully met. If you provided more than one service, you could continue to add them from here by clicking the button that says Add Another. But since we only provided Tom with these 2 services, we're going to click Save and Exit. Once you do, it takes us to our service dashboard, and then you can click the button that says Back to Dashboard. That will take you back to your service transaction dashboard. From here, you can return to your home menu because you have successfully completed a path entry, a path update, and how to enter multiple services for a single client. Now, let's walk through the ScanPoint module. Remember, this is the module where you're able to add a single service to multiple people or multiple services to multiple people for the same date. So let's say today is September 1st and we've gone out into the community to outreach some folks. I've entered all of them into the system already, but I need to apply a case management service to set up appointments with each of them. First, I will change my backdate button to reflect the date of September 1st, 2015, and set backdate. Then, I would go to the left side of my screen to the menu and locate the ScanPoint button. Once you do, your screen will change to show the Provide Service tab. At the top, you will ensure that the correct provider is listed. Then you will use the drop-down list to select your service type. And in this case, it'll be Case Care Management. Next, you will be sure that your start date and your end date are matching and properly listed. And then select your provider-specific service of Street Outreach. Remember, service notes should never be entered in this box. Then, the type of path-funded service provided. This is where you're going to use that drop-down list to select one of the options of outreach, screening assessment, habitation rehabilitation, community mental health, substance abuse treatment, case management, residential support service, housing minor renovation, housing moving assistance, housing technical assistance, security deposits, one time for eviction prevention, and other path-funded services. This case will select case management. Then, skip over your service cost section, as well as the apply funds for service. Next, we will need to select what clients we'd like to apply this service to. There are 3 different ways this next part can be completed, but out of the 3, Path can only use 2. So we will complete an example for each of the 2 options. Option number 1 is to choose clients from unit list, and this is the option that is unavailable to Path projects, since your client does not use the shelter point module. So next to it, you're going to locate the button that says Start Scan and click it. This option lets you search for clients by their HMIS ID number or by their name. So once you do, your screen will change and a box will appear with the title that says Scan ID Cards. In this pop-up box, again, you're able to look for your client by their name or by their HMIS client ID number. Once you've located the list you wish to apply the service to, a list will be created at the bottom. So to work through the different ways of adding your client using this option, Let's start with the client search. You will see an arrow next to it that is pointing towards the right. If you take your cursor and click on the arrow so that it points down, it will expand the search option so that you can type in your client's name to search for them. At this point, we'll type in Agent Cody Banks and click Search. Once you have a list of clients, you will select the appropriate client you wish to apply the service to by clicking on the green circle with the plus sign located to the left of the client ID and the name. Once you do, you will notice that your client is now listed at the bottom of your screen to show that this service has been applied to their profile. You can continue to use this method to find your clients, or you can search by their HMIS ID number. To do that, look for the area that says Scan Client Barcode. Use the text field box to type in your client's HMIS ID number and click Scan Barcode. For this, we will search for our client number 82 and click Scan Barcode. Once you do, you'll notice that at the bottom of your screen, the client you just searched for is now listed. If you prefer to work through it this way, you can continue to use this method to find your clients as needed. Now, as a side note, in the event that you added the wrong client to this list, there is an easy fix. Locate the incorrect client on your list and use the trash can to the left of the name to delete it. Once you click on it, a warning box will appear and ask you if you're sure you wanted to delete this entry. This is where you will click Yes. If you are done creating your list, look towards the bottom right of the screen and click Exit. This will return you to your Scan Point Provide Service screen. And at this point, you will need to know that the computer did its work in the background and attach this specific service to the list of clients you've created. Now, option number 2 is the Choose Clients from a Client List button. Before you begin to use this option, you must create a client's list in the Manage Client List tab within the ScanPoint module. This tab is located at the top of the screen, so once you click it, your screen will change to show previously created client lists if applicable. Next, you will locate the button at the bottom left and click Create New Client List. Once you do, a pop-up window will appear to allow you to name your client list. Then you will make sure that the correct provider is listed. Then you'll click Save and Continue. Once you do, your screen will change and you will see a header that says Client List, HMIS Path Trainer List. This is where you will create your client list. You can add the clients by typing in their HMIS ID number in the Type or Scan Client ID to add text field box, or you can click Search to search by their first and last name and social security number. If you choose to add them by the client ID number, you will type in the number and then click the Add New Client to List button. If you choose to search by their name and other criteria, you will click on the search box, then type in the information you have, and click Search. Once you do, a list will generate under the search results, and to select the client, you will click on the green circle with the plus sign to the left. Now, it will seem like nothing happened, but in the background, the computer did its job and added this client to your list. Once you've completed searching for and adding your clients to the list, click Exit. It will then take you back to your client list page to see where they're listed. And once you've created your list, you can click Exit on the right. And once you do, it will take you back to the Manage Client List page. From there, you will click on the Provide Service tab. And at the top, you will ensure that the correct provider is listed. Then you will use the drop-down list to select your service type, and in this case, we will go ahead and use Case Care Management again. Next, you will complete your start and your end date. Again, it should already be automatically populated, but if it is not, please complete it. List your provider-specific service of straight outreach. Don't forget your type of path funded service provided question. And then click on the button where it says Choose Clients from Client List. Once you do, your client list pop-up window will appear and you will select the client list you wish to add this service to by clicking the green circle with the plus sign next to it. I've located my HMIS Path Trainer list and now I will click this green plus sign. Once I do, my screen will change to show the list of clients associated to this specific client list. And then you will check mark the names of the clients you would like the service to be associated to and click Enter Service for Clients. A pop-up box will appear stating services were successfully entered for the number of clients, and then you will click OK. And again, option number 3 is for projects who use the shelter point module within the system. Your project does not use this, so you are not able to use this option. We understand that it can be nerve-wracking not knowing if the service was applied to the clients, but we can assure you that the computer worked in the background to attach the service that you, the user, has created to the client's profile. Now, please return to your home screen to work through the next example of creating multiple services to multiple clients using the ScanPoint module. I have a group of clients that came to me needing housing counseling and personal financial counseling. I have provided that service and need to document it within the system. So, go to the left side of your screen to the menu and locate that ScanPoint button. When you do, your screen will change to show the Services tab. Next, you will click on the Multiple Services tab. This is where you will be sure that the correct provider and your dates are listed, and then you will enter in the number of services as 1, and then you will choose your service type of housing counseling. Then don't forget your provider-specific service and your type of path-funded service provided. You will skip over the service cost section as well as the apply funds for service. And then you'll need to complete your need information. So your need status will be closed and your outcome will be fully met. Then click Add Another. Then be sure that the number of services is listed as 1. And next you will choose your service type as personal financial counseling. Then you will select your provider-specific service, your type of path-funded service provided, skip over the service costs, skip over the apply funds for service, and complete your need status as closed and your outcome as fully met. Next, you will decide on the option that works best for you in your project workflow to select the clients to apply these services to. I will use the Choose Client from Client List option since I have it already created with the clients these services apply to. Once I click that button, the Select Client List pop-up window will appear, and I will select my client list by clicking on the green circle with the plus sign. And again, once I do, my screen will change to show the clients on the specific list. I will check mark the names of the clients I wish to apply the service to, and then click the button that says Enter Service for Clients. As a reminder, a pop-up box will appear letting you know that services were successfully entered for the number of clients. Then you can click OK. Now, please return to your home menu. To reiterate a few key points, let's look over this summary. According to the HMIS Data Quality Plan, you must enter your clients into the system within 5 business days. The U.S. military veteran question is initially answered on the client search screen, but it can also be answered on the client profile screen. When creating an entry at first contact with your client, you must go through the EntryExit tab. The first contact date and location must be recorded within the outreach sub-assessment at the top of the path entry assessment, and at least one service should be recorded at each contact. Client demographic information should be gathered as it becomes available and should always be recorded on the EntryExit tab through the path entry assessment. Outreach teams are not held to continuum data quality plan on completeness until the client becomes engaged, but all data gathered should be filled in and updated as much as possible until then. HUD considers the last permanent address to be where the client was housed for 90 days or more. Remember these points when completing the length of time on streets, in an emergency shelter, or safe haven section. Only answer yes to the first question when the client is entering your project directly from the streets, an emergency shelter, or safe haven. The exception is if they were in an institutional setting for less than 90 days and came from one of those locations just before being institutionalized. When entering the date the client's current episode of homelessness started, you may use their current entry day into your project if they cannot remember the exact day. For example, if their entry date to your project was October 3rd of 2015, but they only remember their last episode of homelessness starting in May sometime, then you can put a start date of May 3rd, 2015. Count the number of times the client has been homeless in the past 3 years, even if they're not entering your project directly from the streets, emergency shelter, or safe haven. Only use never in the past 3 years for diversion or homeless prevention because the question says to include today as an episode. Add up the accumulated months of homelessness during the past 3 years where the client was either living in the streets, in an emergency shelter, or a safe haven. Any single day or part of a month counts as one full month for this question. Each subsequent contact date and location must be recorded in HMIS via interim updates. Interims is located on the EntryExit tab. The Path Update Assessment defaults, which also has the Outreach sub-assessment at the top. Again, at least one service should be recorded at each contact. When wanting to record a service to a client's profile, you will do so on the Service Transactions tab. When adding a service, the start and end dates auto-populate, but be sure both are completed. Do not leave the dates blank. The service type list has been set up for path projects specifically, so please do not deviate from the populated list by using the service code lookup. Path projects also have additional path-specific service type question that must be answered each time a service is recorded. The need status of a service should always be set to closed, and the outcome of the service should always be set to fully met. When wanting to record a service or services to multiple clients at once, you will use the Scan Point module. When using the Scan Point module, there are only 2 options that can be used by path projects. Option number 1 is to start the scan. This is where you can search for each client by their name and social security number or by their HMIS client ID number. Option number 2 was choose from the client list. First, you must create a client list through the Manage Client List tab. Then you can apply the services to the specific list of clients. Please note that the unit list option cannot be utilized by path projects. When wanting to review or make corrections on existing services, you will go to your client's profile and locate the Service Transactions tab. From there, you will click on the View Entire Service History button. By following these steps and working through the examples in a scenario, you have completed training on Path 300, Entry with Contacts and Services. As a reminder, if you have any questions, feel free to contact us at the HMIS Help Desk via email at hmisupport@cir.org or by phone or text at 602-908-3605. Thank you, and please refer back to your training confirmation email for further instructions.